Hi.
Hi Hi9 viewers, name Dr. Preetham. I am a consultant pediatrician at Rainbow Secunderabad. Now the question for today is, why does my baby cry too much? Now there are different reasons why a child can cry. More so, this is common in babies who are around 1 to 3 months of age. So 1 to 3 months of age, we get something called a colic. So as the intestine starts maturing, there are different things and different mechanisms which happen in your body. So this causes some bit of disturbance in the flora, which causes the colic. This colic is commonly seen in babies in the evening times. Now why this happens, nobody knows, but it is seen more so in the evening times, where the baby cries incessantly for few minutes and sometimes for few hours also. And during this crying, they tend to get the legs onto their abdomen and then try to cry for a lot of time. So, and this is the commonest reason why it happens. But other things what you need to watch out for especially is, one, lack of feeding. Because if you are not feeding, if a baby is hungry, naturally every baby would cry. So that's the first thing you need to look out for, especially in small babies where they can't ask for food. So first try to feed the child. Anybody who's crying, first try to feed. The baby is not getting consolable, then we'll have to look at other things. Other reasons which can cause it is, one is ear pain or a nose block, or sometimes your baby might be breathless. That's why the baby might be crying too much, or gasping for air. That's why she is irritated and crying too much. And few things which are missed out are more so in male children, the testicular torsion or inguinal hernias, where you have hernia and you are not diagnosed yet. That is where you can look at the excessive causes. And recently we got a case where the child was excessively crying. Then the reason was, the child was put on mittens, and one of the mitten, there was a thread coming out which completely was trying to choke the blood supply to the little finger. So that's why the child was crying immediately, incessantly. And the moment you removed the mittens, the child became all right. So these are something which you need to watch out for. So ideally, I would say, whenever a child is crying, first undress the child and see what is wrong in the baby. Suppose after you remove all the clothes and the child is still crying, then you look out for other reasons. So thank you for watching.